Okay, everyone. Thank you for joining us this morning. We're here with, I'm Adam Raymond, the Communications Director with the Kentucky Center for Economic Policy. And we this morning have published a new survey of more than 1,300 Kentucky parents about their experiences with childcare. I just dropped the link into the chat. So we're here to talk more about this survey and to hear from some of the parents. And we will start it off with my colleague, Dustin Pugel.
Hey everyone, my name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. And back in January, many of you may recall, we at the Kentucky Center for Economic Policy and Kentucky Voices for Health surveyed providers, childcare providers, about how they anticipate the coming federal fiscal cliff would affect their ability to provide care in Kentucky to Kentucky kids and their working parents. And we heard from them that the result would be an increase in tuition rates, potential layoffs, and possible closures of their centers altogether. This was alarming to us and led us to wonder what parents' experience of childcare is and how they would respond to these changes. So in the beginning of March, we surveyed 1,357 parents from 88 Kentucky counties, and we learned that Kentucky's parents are feeling the crunch of childcare in their finances and their life decisions. Specifically, we learned that families are spending a lot of their finances on childcare, and they expect to pay more soon. Among private pay families, as opposed to those receiving CCAP, 30% are spending somewhere between $100 to $200 per week, 30% are spending $200 to $300 per week, and 28% are spending $400 or more per week for childcare. 6 in 10 of these families have seen their tuition increase recently, and another 15% expect that to increase soon. Spending so much on childcare has forced really difficult choices for these families. So while 2 in 3 respondents reported reducing non-essential spending to afford childcare, over half reported delaying major purchases like a car or a home. 38% are going to family to receive financial support for childcare. 34% reduced their essential spending. 32% reduced or used emergency savings to be able to afford childcare. 30% delayed or decreased retirement spending, 29% accrued credit card debt, and 24% delayed healthcare needs. This burden of childcare costs is leading to significant changes for many families as well. 45% reported that they've had to change jobs to gain flexibility related to childcare. 39% say they've had to alter their work hours. 22% waited longer to have additional children than they would have otherwise, and 20% delayed having children altogether. A full 12% actually left the workforce at some point in order to stay home and care for their children. Parents are also worried about their childcare arrangements and what might happen if they lost them. So the main concerns that respondents shared were that they wouldn't be able to find childcare elsewhere. That was about 79% of respondents. They might have to use lower quality care for their children. That was about 69%. They would have to have unreliable care that might impact their job or their studies. That was around 2/3. Or that they would be forced to leave their job or schooling and stay at home with their children. That was 59%. Limited childcare options nearby are leading to really long wait lists for many parents, and you're going to hear a little bit about that today from some of our parent speakers, and really long commutes for some. So 62% of families have been on a wait list for childcare at some point in the past. Of those who have been on a wait list, 42% had to wait 2 to 6 months, 22% had to wait 7 to 12 months, and nearly 1 in 5 had to wait for more than a year before a spot opened up for their children. Most families were able to find some form of childcare nearby, so 7 in 10 respondents reported a relatively short commute of 15 minutes between their home and their childcare provider, but nearly 18% of respondents had to travel 15 to 20 minutes each way, and nearly 14% of respondents had to travel 20 minutes or more each way every day for their childcare. We also learned that a lot of families are eligible for childcare assistance, but they're not participating in it, even when their kids are in care. So while 22% of respondents reported participating in CCAP, 37% of respondents reported a household size and income that would qualify them for the program. In other words, 1 in 3 households with children in care are not receiving assistance that they are likely eligible for. Now we're going to hear from several parents who participated in the survey, who can share their experiences with trying to find and afford high-quality childcare. We believe these results and the stories behind them, like those you're going to hear, build a compelling case that Kentucky must invest the necessary resources for a healthy and robust childcare sector for these parents, their children, and our Commonwealth as a whole.
Thanks, Dustin. Now we'll hear from Courtney Rhodes Mullins.
Hi, yeah, my name is Courtney, and I am also an expecting mother. My family and I are expecting twins in May, and I, to be completely frank, did not realize how difficult the childcare system in Kentucky was until it became our opportunity to start looking for childcare and quickly realized that of the handful that are available to us in Letcher and Pike County where we live, one will only take them when they're 3 years old, which leaves the question of what do you do until they're 3? And then the other is not have an availability until expected in April of 2025, and my twins are due in May. So we're looking at possibly a year, 2-3 years before having any type of childcare or daycare available to them. And to be completely honest, I don't think it's fair. It's not fair to, require someone to stay home, but it's also not an option for my family. My husband is a teacher in the public school system, and I work for a local nonprofit here in Letcher County. And, to be completely frank, the loss of an income would not be able to be sustained in our household. And then additionally, we would lose our medical care because our medical care comes through my job. And so we really are having to make difficult conversations or have difficult conversations and make difficult choices as we try to celebrate the opportunity of having these twins here with us soon, but at the same time of like, how do I go back to work when my maternity leave ends? And I think too, the other thing is some of that is put back on the employers to be really flexible when the state could be providing economical opportunities to improve the daycare systems and to make a more robust system of daycares in our area. The other thing that is really prevalent in our area is Letcher County obviously was hit by a very catastrophic flood just a couple years ago. And we're still seeing so many lack of resources in this area. And you talk a lot about the need for economic development, but until there is a robust system of childcare, we're not going to see any change in our community. And so, I really think it's so important when we talk about the need for childcare is not only like it impacting your family, but it's impacting so many of our communities. It's impacting the opportunities that people have to go out to work every day. And until the state decides to provide sufficient funding for these opportunities, you cannot expect Eastern Kentucky or our state to grow and to thrive economically. Thank you.
Thank you, Courtney. Next up, we have Keisha.
Hi, yes, my name is Keisha. Thank you for having me. So my experience might be a little different than most, but I have a 2-year-old and a 7-year-old, and I had never used the daycare system prior to my 2-year-old being born. I had always had the opportunity to have my family watch him while my husband and I worked. When we gave birth to our 2-year-olds, I struggled a lot with postpartum depression, and I don't think that mental health is talked about enough as far as the opportunity, presented itself to where I was fortunate enough to work from home, but the problem came in to where my family wasn't able to watch him like they did my first son. And so I was caught in the crosshair of, okay, do I try to keep him home with me and watch him or put my trust in a stranger? And that was a very, very difficult decision, especially struggling with never having used childcare before and having to put my trust in someone that I hardly knew. And so when I found that perfect daycare, I would say it opened up this world for me when I was struggling so much postpartum with the anxiety and the depression. And when I found that childcare center, it's an in-home center, and they treat me and my son like family. And I do part-time, so I put in daycare twice a week, so that gives me time to focus on my work and to focus on my mental health and to be a better mother for him. And I know that if I were to lose that, if, for example, if they were to lose funding or they were to be short staffed because of this, it would be devastating for my family and for myself and for my son as well, because he's so used to this. We've been in it for a year now, the same faces, the same people. It took a lot for me to trust, because this is something that I had never done before. And if we were to lose that again, it would take a toll on my mental health again. And again, I think that's something that's not really talked about a lot, especially postpartum and things like that. So daycare has been a huge blessing for us. And the thought of losing that because of this would just be horrible, you know? So I really, really thank you all for giving me a voice and a chance to express that. So thank you.
Thank you, Keisha. Next up is Lisa Leonard.
Good morning. I am a grandmother who had custody of her grandson. I got custody when he was 3 years old. I was working a full-time plus job, a salary job, and was just, my kids were never in childcare. My mother took care of my kids. I was fortunate enough that my grandson qualified for Head Start, and we had the most wonderful Head Start program a lot of people said they'd ever seen. He was there from the time they opened until the time they closed. It was a 40-minute round trip twice a day to get him there and pick him up, which took time out of work. But again, I'm salaried. I had a flexible job schedule. So I managed to squeeze it in by just working nights and days and all kinds of hours and working weekends. It was a wonderful Head Start, and I feel very fortunate to have had him in there. He is 17 now. He's a pretty awesome kid, despite the fact that he's a teenager. And if it hadn't been for the availability of Head Start, I truly don't know what I could have done. I lived so far out in the county and didn't know anybody around me. And again, trust is an issue. Leaving your kids with somebody you don't know is a scary thing. I'm still Facebook friends with his Head Start teachers from that many years ago. And they would call me and tell me if there was a problem or if he'd done something really awesome that day. And they were wonderful. And I appreciate them very much.
Thank you, Lisa. Tiffany Hayes, you're up if you're able to come on camera and off of mute.
Hey, I apologize. I'm on my phone, which is not as nice as being on my computer.
Totally fine.
Can you guys hear me okay?
Yes.
Good. So I am an oncology social worker at a small rural clinic. There is already a shortage of social workers in the state of Kentucky. And my field is even more niche, or I guess my subfield, which is oncology. There's actually only one oncology social work job in the county that I live and work in. I have a 5-year-old son, and I'm expecting my second child in June. So when we got out of daycare and stopped having to pay the cost of daycare, which was $140 a week, and my son qualified for preschool, we were ecstatic because that decreased our childcare costs down to only $90 a week for aftercare. That aftercare cost, then this past August, when we enrolled him for his second year of preschool, doubled to $185. So that is $740 a week, and or a month, I'm sorry. And when we left our daycare that was taking care of our son until he went to preschool, the cost for an infant was $235 per week back in 2022. I imagine that cost has gone up, and I haven't explored the possibility of wait lists yet, just because it makes me pretty anxious. But I've added this up for a whole month, and if the cost hasn't increased from 2022, we would be paying $1,680 per month in childcare alone. That's more than our mortgage. That's more than any bills that we have. That's more than our student loans. And it's just really scary. So my husband and I have been thinking, and I've been thinking really, really seriously, unfortunately, about leaving the full-time workforce and having to enter stay-at-home motherhood, which is still a job, and it's a really tough job for a lot of people. And I don't think a lot of people get enough acknowledgement for how hard that is. We were also in the situation where we were doing kinship care back in 2021 and 2022 and part of 2023. And when we received custody of a 12-year-old at the time family member, of course, we needed childcare for him as well. And because we were in kinship care and not foster care, we didn't have support from DCBS to assist us in how and what kind of programs we could use for him for after school care. And our county that our case was out of only had 3 workers at the time. So they really didn't even have the bandwidth to do anything beyond the neglect and abuse cases. So with having to pay such a high, or anticipating to pay such a high childcare cost, we've weighed it out. And if I have to stop my job, that's going to be really tough. I have loved and enjoyed what I do, and I have found a unicorn job that will let me leave and go to activities at my son's preschool and come back and make up that time later, or take PTO. And I don't have to put in a request really far in advance for that. And I'm scared that when I'm ready to re-enter the workforce, that my job won't be available. And I have this really niche training that I've worked really hard to get when my parents didn't graduate high school. So I have a lot of pride in my work, and I'm really scared about having to give that up and having to live paycheck to paycheck, or not be around my kids, or face the option of having really low quality childcare if we can find it.
Thank you, Tiffany. Next up, we have Valerie Frost.
Hi, everyone. I wanted to thank you all for having me here on the call today. Gosh, everyone's story is like a little bit unique, but I feel like it could be any of us as a parent. And even just going back to the survey results, like that wasn't all just me, but I do feel like it could easily be any parent. So my name is Valerie Frost. I am a mom of 3 kids 6 and under in Clark County, Kentucky. And all 3 of them use some form of childcare, whether that's daytime care or after school care. So over the last few years, I have been using the Child Care Assistance Program, or CCAP, which has allowed me to advance from being a part-time hourly wage worker to a full-time salaried employee. And I was also able to make a large purchase. So I became a first-time homeowner during this time, which actually decreased our housing costs. So it's been really helpful for us. So childcare is absolutely essential for my ability to work and provide for my family. But it's not just important for families like mine right now that are on the CCAP program, because I am also literally right at the very edge of facing the benefits cliff. I actually calculated it to see like how close am I to there. So I'm looking over the edge here. So I would love opportunities to further my career and to pursue those opportunities. But the reality is a very small increase in my pay would shift me into paying the full price of childcare out of pocket. And I would actually be paying more for childcare than what I would make with that small increase in pay. So it would take a substantial pay raise for me to scale that. Actually, a really surprising number. So realistically, at that point, I would have to decide between turning down a raise or not being able to afford care. So I just want to emphasize today that quality, affordable, accessible childcare is essential, and the CCAP program does open doors for many families, but there also needs to be universal childcare support for all working families to cover families like me now, but also families like I could potentially be.
Thank you, Valerie. Savannah Davis, you're up now.
Hello, my name is Savannah Davis. I'm a community health worker here in Barberville, Kentucky. I work at Access Family Health, and I work with a wide range of individuals, but mainly I work with mothers, newborns, children, and a lot of single mothers. So I see almost daily the effect of childcare, that, you know, how big of an impact it is for these mothers. And if they didn't have it, where would they be? They simply would not be able to work. And if they didn't have childcare, they wouldn't be able to work. They wouldn't be able to provide for their children. With childcare, you get, you know, the 2 meals a day plus a snack, and that's a lot. You know, when you're going out and having to buy groceries, the cost of groceries these days, we all know, is extremely high. And here in Knox County, the majority of the jobs are minimum wage. So they can't really survive on that. I know with childcare, you know, they provide a safe and healthy place for our children. They're the frontliners of being able to see neglect and abuse in children. And, you know, they know what to look for. They know the signs. And if something like that comes up, they have these children in a safe place to where if they need to take a next step to do something about it, they have these children in that safe place. I don't have children in, you know, childcare, but I have a lot of family and friends and patients that have children in, you know, daycares. And I can see that the skills that they learn while they're there, as far as their social, emotional communication, is so big. My nephew, you know, he just turned 3 and he's been in daycare since he was a little baby, and he's one of the smartest 3-year-olds that I know. So he'll have all this for when he starts school. He'll know how to interact with kids. He's smart. He knows things that a lot of 3-year-olds don't. And that's a big thing for me. I wish that in childcare, there were more childcare providers that were able to take on kids with special needs. I have a friend that has a special needs child, and she's unable to find a daycare for her child simply because she has special needs. Would these childcare providers take them on if they could? I'm sure they would, but they don't have the knowledge to know how to take care of this special need child. So I, you know, feel like childcare plays an important role in our lives, down to being able to work and having your children grow and be healthy and learn. So I feel like childcare is kind of like the middleman when it comes to the workforce and then your children growing. So I know it would be a big impact if childcare was to increase and the cost of it go up, because simply the cost of living and the way you have to live today is really hard. And single moms have it hard, and they don't need it to be any harder. And that's what I have for you today. And I thank you for having me.
Thank you, Savannah. So now we'll hear from Kelly Talby at Kentucky Voices for Health, and then we'll have time for some questions from reporters.
Hi, good morning. My name is Kelly Talby. I am the Director of Communications and Development at Kentucky Voices for Health. Advocacy around state investments for early childhood education to support Kentucky families is a priority for KVH this year. The improved health outcomes, the well-being, the educational and professional attainment of a child is inextricably intertwined with a family's ability to access affordable, high-quality childcare. And we now know that 90% of a child's brain development, the foundation for the rest of our lives, happens before they go to kindergarten, before the age of 5. So think about that. It is absolutely essential that we prioritize early childhood education in the moral document that is the state's budget. And yet to date, Kentucky is only sending about $128 per year per child to early childhood education, in contrast to the $2,632 in per year per child in K through 12 SEEK funding streams. Meeting the basic health-related social needs of our working parents and families means that state investments can and should impact access and affordability. But that financial burden and making those investments up front cannot be solely carried on the backs of our young families who are not typically at their maximum earning capacity at the time that their children are youngest. And when the majority of our current workforce is also the same group of people experiencing the lowest amount of generational wealth, we are truly at a healthy workforce crossroads. As family by family make the hard decisions due to childcare constraints, we know that parents leaving the workforce is disproportionately felt by women. And our women dominated industries locally, those are our social workers, our community health workers, teachers, friskies, nurses, and yes, our preschool, kindergarten, and our childcare workforce. But not only as a health advocate before you today, but as a working mom of twin 19-month-olds myself, I cannot co-sign enough the sentiments everyone has shared today. We, the parents, are all acutely aware that Kentucky is not only a big old childcare desert, but the childcare that we do find is expensive and often unsustainable for us. I was on more than a dozen waiting lists at one point, several before my babies were born in 2022. And the first real phone call I got were when the babies were about 10 months old for a single slot, not two. I was willing to drive up to an hour away to make it work, and I'm still on at least 7 waiting lists right now. And I can personally say that without a shadow of a doubt, in all of my past professional roles, I would have left the workforce by now. Even with having the extremely supportive job and work environment that I do, I was really challenged the first year of my baby's lives on whether or not to continue working. My schedule is still very week to week, day to day at times. I call it a very logistical mosaic, and I just piecemeal it together with the support of my husband, who also works full time. My mother, if she's feeling okay health wise, helps us out some. I have a phenomenal postpartum doula. And I lucked into a part time in home daycare last fall. We've tried care.com, application to application. We shell out about $600 to $850 per week right now, and we make it work because we don't really have a choice not to. So many parents, though, do not have the professional courtesies that I am blessed to have and know. And I honestly don't know how they do what they do, knowing what my own experience has been. And I'll quit talking. I'm sorry. The issue before the legislature right now, some say is a chicken and egg dynamic, or a rock and a hard place, or a catch-22. Okay, I actually like the metaphor of it's that child toddling towards danger that doesn't know it's a dangerous situation. Traffic, a flight of steps, a cliff, and any of us, parent or not, would leap into action to save that child's life. The childcare cliff before Kentucky this year is totally preventable. That is the wonderful news about all of this right now. Our state lawmakers can absolutely stop that anecdotal child before it steps into harm's way. And the responsibility of raising healthy and bright children is on all of us. It's a policy choice whether or not to invest in upstream interventions to support the whole health of a person. Our children, the hardworking families who love them, the local economies who foster them, we all deserve more. And I hope that the voices empowered this morning and within the survey report are taken very seriously by our lawmakers in Frankfort.
Thank you, Kelly. Okay, so that's all of our speakers. We have a few reporters on the call, and if any of you have questions, now would be a good time. Sarah, oh, I see a couple. I'm going to drop the survey link back in the chat in case anyone missed it, and scroll back up. There's a question for you, Dustin. I'll just let you take it.
Yeah, so, I do think that parents, be they mothers or fathers, who have the financial capacity to and would like to stay home with their young kids should have the freedom to do so. Now, I don't think anyone's suggesting a truancy court for childcare or anything like that. The issue at hand, though, is that we know that there are a lot of parents who would like to be able to continue their career or start their career at the same time they're raising a family. And for those parents, childcare is essential. So, I don't have a direct response that mothers should just stay home. And I agree that that's often pointed at mothers and not fathers. But the reality is that a lot of mothers are involuntarily staying home because they can't find or afford childcare nearby. And I'm sure a lot of the moms on this call would like to respond to that question as well.
I would just like to say, I told a couple of y'all earlier, I work in a recovery center for women and children, and I have seen such an impact on how much childcare affects the mothers that are in recovery. Like, we almost say they're at a disability whenever they have a disability when they don't have childcare to start their lives. They're literally starting their lives all over, and our childcare closes at 5 a.m. I don't have an 8 to 5 a.m. job. I have a good job that lets me attend things for my children, and then I take that in consideration with my staff, which were most clients here. They have children that get sick and things like that, and need to leave, and then have behavioral issues. If we've had some clients that their children are fine and can go to child care and they flourish, and then a lot of these children that we're working with have been exposed to things, so they send them home, and then we're teaching this mother these skills and telling her we're going to help her start her life over, and then she can't get childcare and work, and she goes back to the same place where she was at. So I would love to see more childcare, especially in southeastern Kentucky, just because I know how much of an impact it can do for these ladies, and even the dads. Like, I have several friends that are in recovery, and they're open up recovery centers for men and their children too. My dad raised me as a single father, so these are things that I have passion for. But I look at my staff as they're sitting here, and then I was having to sit here with children while they're in class trying to learn and work through all these issues and things that they've been faced with. They can't even talk about in group if they're 5-year-olds sitting there, like, they're trying to overcome all this. So I wish sometimes that people could sit and talk to them and see how much this could impact like the next part of their life, and like actually having a life and starting over, and know what that means for them.
Thank you, Michelle. Could you say and spell your name for any reporter who might want to use what you just said?
Yeah. It's Michelle Baird, but I'm going to type it too.
Oh, thank you. Thank you.
Sarah Ladd, I just read the second part of your question too, and I think it's an important one. According to the Federal Reserve Bank of St. Louis, about 65% of mothers of young children are in the workforce, but about 95% of fathers of young children are in the workforce. And, a constant conversation we hear in Frankfurt right now is that we need to get more people working. And, this seems like a situation where you can't have your cake and eat it too. If you want to get people into the workforce, the primary group of prime age folks who are not in the workforce are moms, particularly moms of young kids. So again, I don't think we should, force moms into the workforce, but if there is an opportunity for them to pursue a career and earn a living for their family, then we're going to have more investment in childcare, which kind of goes into Sarah Michael's question of what would, is $300 million too high? Well, for starters, what we've been receiving from the federal government is about $330 million per year, in large part through direct stipends paid to childcare centers, and then to a lesser degree to very particular improvements to quality and assistance. $300 million that Senator Carroll's proposing is over 2 years, so it's really about $150 million per year, and that's less than half of what we're currently investing through federal dollars in childcare. So in the last 10 years, we've seen a dramatic decrease in the number of providers, which has only increased cost for families and decreased availability for families. If we don't continue a significant investment like Danny Carroll's or others, we're going to see that slide continue, and things are only going to get worse, and it's only going to make it more difficult for parents to be able to find and afford a place with their kids so that they can work. So this has a direct economic impact in that we're going to lose childcare centers and we're going to lose the salaries that are being paid and the economic impact that those have, but we're also going to have a secondary impact in fewer people working in the workforce.
Kelly, did you want to add to that answer at all?
Dustin touched on some of the more economic numbers and figures about that. And the only thing I'll tail into, we want childcare to be expensive, right? While we can scale many other industries, and even when you look at K through 12 or post-secondary education and keep it in the same lane, you can get smart boards. You can have different types of facilities that accommodate remote learning and that sort of thing. But we like to say no iPad is ever going to change a baby's diaper. No smart board will ever soothe a crying toddler. It takes a lot of people, and we want them to be highly skilled, highly trained, safe workforce. And so it's going to cost more. And so when our providers cannot maintain their own workforce due to those constraints at the same time, again, we have the ability with this state's budget to invest the monies necessary to both relieve our childcare workforce, but support working families, which is what the focus of today is. But I can make a very strong argument on why the industry that supports all industries, our early childhood education, why it should be expensive.
Thank you. Dustin, do you want to take Sarah's next question?
Yeah, that's a really good question. So Sarah's asking, she's noting that there are many families who seem to be eligible for CCAP but are not currently participating in it. And if we asked if there are any reasons why that's the case, the short answer is no. And in fact, if we did a follow-up survey, I think that would be top of my list. You know, are you aware you're eligible? And if not, or if you are aware and you're not participating, then, you know, why not? From some of the stories that participants shared in the open-ended responses that we asked for, you know, I had some hunches. I think it's likely that there are not enough open CCAP spots available. So some childcare centers will reserve a certain number of spots within their center for CCAP participation, and it's likely that those spots aren't available. It's also likely that some parents are opting to place their kids in higher quality care settings that may not offer CCAP at all, which there are many that don't participate in CCAP. But you know, those are basically just me reading between the lines from a lot of the comments that were provided. That's definitely something I'd like to follow up on.
I would just like to add to that too, just like on a personal level experience with my clients, like we try to sign them up on CCAP. A lot of it is like the slots, and then once again, behavioral issues. If the child has a lot of behavioral issues, our local center is like, no, we can't handle them. We just don't have the staff here. We don't have, you know, anybody that's their forte. It's like behavioral issues. So they will opt out. And then once again, going back to here, we're trying to tell her to work, but she has no child care and no one to watch this child. So that's why a lot of our clients don't participate in it. And then the lack of just following up and education on how to do that once they leave here. Like we're not, you know, they don't have us anymore to stand there and be like, hey, you got to go re-sign up. You got to do this. You got to, like, those steps and knowledge to do that past here.
Should also say that while CCAP is really important and helpful, it's a public assistance program, and public assistance programs are Byzantine and difficult to get on and keep. And I know Valerie has had some experience with CCAP and also some difficulty in maintaining eligibility. So, you know, there's also just sort of an inherent difficulty in navigating public assistance programs that could be improved.
Okay. Well, if there aren't any more questions, and it does not look like there are, I think we can end the call. Thank you to everyone. Oh, go ahead.
I wanted to say something else about, again, a lot of what these parents experienced, I feel fortunate not to have because I found such a good Head Start program. Even at that, I still had to think about, I was 50 years old and I paid for my health care and I paid for my retirement. And now I had to pay for raising a child again. And I could only afford to do 2 of those. So I quit putting into my retirement to raise another child at 50. I feel very fortunate to have found the health care that I did. They actually spotted his behavioral issues way ahead of time and worked with me on them. And I'm grateful I had them. And now I'm 65 and I'm retiring and I get to worry about that.
Thank you, Lisa. Well, thank you everyone who joined us. We really appreciate you sharing your stories. And again, the survey is on our website, kypolicy.org. To the reporters, we'll be sending around some recordings if you missed anything. But yeah, unless Dustin, Kelly, anyone else will to say anything, I think we're good to go.
Just thanks to the parents for coming and sharing vulnerably and powerfully. Those are hard situations to be in, and it takes bravery to share it.